I thank you so much for your time. I have to go the other side of the debate, fair and balanced. Here with us is Republican Congressman Michael Burgess. He is a medical doctor and chairman of the Congressional Health Care Caucus, a GOP group. And I'm not sure, Congressman, if you heard the prior conversation, but Max Burgess of the Senate Finance Committee says that we can save money by eliminating certain treatments and eliminating certain tests. So in essence, what we're hearing is the government is going to tell you, Dr. Burgess, what you can and cannot do for your patients.
Well, I think that's what you just heard in your previous interview, where remember that one person's waste is another person's critical intervention. So who's going to make those decisions? And that's something we heard testimony about last week, or the week before, rather, before we went home on the recess. Mm-hmm. The Secretary of Health and Human Services will be making a lot of those decisions. And quite honestly, we don't really know where the parameters surrounding those decisions are going to be. So a lot of this is really up in the air at this point. The hospitals, they came to the table with some stuff, but are they going to be asked to give up their disproportionate share payments? How excited are they going to be to do that?
Well, and Congressman, in fairness, the White House says they're going to come up with a plan. They're going to come up with something to pay for all this, and a lot of it's going to be cuts, and admittedly, they said a lot of it's going to be some tax increases. The question that everybody else has is, if this thing fails in Congress, it's going to be because the lawmakers on Capitol Hill cannot come to on how to pay for it. And I don't think anybody, save for massive tax increases, has figured out a way to pay for this thing.
Well, and that's why the discussion about how to pay for it has drifted to the very end of the debate. Remember that when President Obama was running as a candidate, over and over again, he accused Senator McCain of doing one of the very things that is likely going to happen now, which is taxing the employer exclusion on health benefits.
But that's off the table. Even a lot of Democrats are saying, look, we don't want to do that. We can't do that, right? Because 56% of Americans are against it, the unions are against it, and the midterms are coming up, and they really don't want to do that.
Which is why the push is on to get this done rapidly. Forget about doing it right. We just have to do it quickly, because after all, we've got midterm elections to win. That's exactly the wrong approach, and that's really what's going to lead us down the road to significant trouble with trying to do something this big, crammed through in this short a period of time.
Congressman, I got to go, but this whole public option looks like it's front and center again. It looks like there will be, in essence, at the end of the day, which is a term that, it's going to happen. The public option is probably going to happen. How much does that hurt private insurance companies?
Well, it's hard to say, and certainly I'm not here to defend private insurance companies.
Sure.
They're responsible for some of the problems that we have. But let's be honest, without the private sector that will cross-subsidize the public sector, doctors' offices couldn't function at this point based on Medicare and Medicaid reimbursements. You go to that public plan, what's the reimbursement going to be like? Medicare, Medicaid? It's anybody's guess, and the only way really that they have to control costs is to ratchet down provider payments. This has been said over and over again, so we all know that's coming. That's eventually going to be part of the plan.
A lot of variables in there. Congressman Michael Burgess. Dr. Burgess, thank you, sir.
Thank you, Trace. I appreciate being with you.
President Obama